If Dr. A knows the technology, can use it, leverage it, and can improve your health, and Dr. B, he loves medicine and is trying but doesn't know, then what doctor would you want? And as we know, medicine is doubling knowledge every 72 days. Back in the 1950s, medical knowledge would double around every 50 years. And so it's really hard for the average person to just be able to keep up.
Retina imaging, fundus imaging is marker nowadays, established in the literature, very strong to predict systemic diseases, known through the microvasculature in the eye.
Well, welcome everybody. My name is Dr. Harvey Castro. I'm really excited. This is actually a little different. Usually Junaid's here, and today he needs a little break, so he's off the next 2 weeks. But we have Ed Marx, and then we have last week's guest, which I'm really excited that she came. And today we have Yeshe, and I'm excited to hear that you're from Germany. And I'm gonna let you just introduce yourself, your background, and tell us about yourself.
As you mentioned, I'm from Germany. I did my undergrad there in medical engineering. That's where I developed a passion about image processing. So the journey brought me to Singapore, where I did my PhD in metabolic imaging, advanced AI-based image processing, very focused on segmentation, which is, I believe, today's topic. So I'm currently a postdoc at the Oxford University, Radcliffe Department of Medicine, Division of Cardiovascular Medicine. So my focus is on precision phenotyping, mainly on imaging-based precision phenotyping to understand, but also to advance, develop tools for precision phenotyping, cardiometabolic risk.
I'm always excited about what's tomorrow. So for me, what really you think is something that's going to happen in 5-10 years from now? You're like, oh my gosh, Harvey, this is going to change humanity. This is what's going to happen. I'd love to see from your angle, what you see. No pun intended.
I think we are currently understanding that a lot of diseases, for example, like heart failure, are more and more multi-system diseases, and this kind of phenotyping segmentation, which is a fundamental pillar of looking into the whole body at a structural point of view. Of course, then with advanced techniques, you can also get information more on a qualitative imaging based features. But then I think it is towards more precision medicine in that sense, understanding body composition, and of course then having these AI tools enable that in terms of discovery in large data sets. Because, for example, these current medications show that they have multi-system, multi-organ effects, right? So I think through these advanced tools, we can really look into the whole body rather than isolated look into disease.
Now we're going away from that reactive medicine and more to that proactive medicine. And then on the personal side, unfortunately, my dad died of a heart attack, and he literally had no warning signs. He just had a heart attack. And on the flip side of that, my mom had thyroid cancer, but she's an ultrasound tech, and she was able to scan herself and one day just luckily found it. And to me, that's proactive because she found it early, she got on medicine, and she's alive today because of that. If not, she wouldn't be here today.
A lot of innovation coming out of Europe and places outside of the United States, and the frustration inside the United States with technologies like this is that even when available, that they're not utilized proactively to the level that we'd all like to see because of the economics of our healthcare system. And it's very frustrating. So I was with some executives from an organization called ChenMed here in the United States, and they do what we call value-based care, and they do want to be as proactive as possible. And what you're doing, this is exactly the sort of technologies they would deploy to keep everyone proactively healthy. Because in the long run, not only is it the right thing to do for people, but in the long run, it saves a lot of money. But there's other, the majority of our healthcare system where it's not like that today. And so there's no incentive, unfortunately, for this capability of being super proactive.
And to piggyback on what you guys are saying, two things. One, to be able to do this for entrepreneurs, our government needs to have some kind of CPT code, something that they're going to get reimbursed for it. If not, they're not going to push for these things, unfortunately. And I get why. The second is the culture. I always talk about that. We need to make sure that us physicians, healthcare professionals understand this technology, and the governance and all of those things are in line so that we can use them. And then the other part of this is the workflow. If these things exist, but I have no idea, and it's going to be 10 more clicks for me to do it, am I going to really do it? So it's important to do all of that as one.
Typically, things tend to trickle down later on into pediatrics, but, do you feel like some of this could apply to the even younger population? When we talk about proactive medicine, I mean, that's getting really proactive, is applying this technology to pediatrics.
In the data, we can see that these things start very early in life, so that is even below puberty. However, the question is always, if we know that, what can we do, right?
That is true. We think, okay, all this knowledge, this access to knowledge allows us to be so proactive, but I could also see the other side of it. And, patients saying, well, I don't really want to know, I don't know, it being almost kind of scared of the pressure of what that does, and especially as a child, I think there's one of the amazing things about pediatrics is the capacity for change and resilience to develop in childhood. And so it's kind of interesting, if you have that in your mindset from the beginning, that you have risk factors for certain conditions, how does that affect, your action?
I love this question. It came up recently where all these countries are doing all these medical screening exams on some of the infants, and different countries will screen for certain things. But it's such a good question. If today I don't know, some patients are going to be like, well, I'd rather not know if there's not anything I can do for it. And then the other side of it is some of the parents are like, no, I'd rather know. So now I can research and keep an eye out for what's out there and try to get on some clinical trial. It's really interesting. And I know as medical school, you and I probably went through this, and that, we went through certain diseases, and they're like, yeah, this is a life sentence on this particular disease. And you're going to depress the patient if they still have 30 years to live and you're telling them that they're going to die. Ethically, what do? Do you tell them or not, or why, or, how do you do that counseling? So it's really, really quite interesting. Being able to interview someone and saying, hey, I'm getting this following feed, and I know this is unethical, and saying, hey, this person's got diabetes, I don't want this person as an employee. I'm going to have to pay them more in health premiums. I mean, stuff like that. How do you fight that?
Well, the first part is quite interesting because I think there's a challenge in terms of, if we think of from a technical point of view at a company, then as you mentioned, the AI has so many predictive values in terms of proving that it can predict something. But then from the healthcare perspective, it is always the follow-up question, what can be done, and what is being communicated to the patient. And I think for a company that focus only on producing a product that can predict something very well, in isolation with what is there in the healthcare system to provide healthcare service, is an incomplete story. Just to give an example, since the topic is also like based on image and image segmentation, like the retina imaging, fundus imaging is marker nowadays established in the literature very strong to predict systemic diseases, known through the microvasculature in the eye, and it is a very cost-effective, non-invasive way to look into human health. And then if you look at literature, it basically predicts, you can build the AI model based on those images to predict all kinds of diseases, from cardiometabolic diseases towards neurodegenerative diseases and other diseases. Then the question is, this is a very interesting area, of course, to provide good service if we also have the clinical care that can follow with that, right? Yeah.
I know I recently saw some information coming out of, they have it all over the U.S., but this one particular case was here in Texas, where they're we're able to do routine retinal scans on individuals and then be able to say, hey, this actual person has pre-diabetic or diabetic glaucoma, and able to jump on it to say, you know what, had this gone unchecked, they would have gone blind. And they were able to catch all these patients because of the algorithm. And family practice doctors that have no real training in looking at that, or even if they could see the back of the eye that well, don't understand. Now the AI being able to analyze, create, and do that predictive analytics and saying, oh, this is what's happening now or about to happen. So excited about this field. And I'll throw in some devil advocate here. If Dr. A knows the technology, can use it, leverage it, and can improve your health, and Dr. B, he loves medicine and is trying but doesn't know, then what doctor would you want? Do you want the one that can really leverage, create, think outside the box, leverage AI, and I call it human plus AI, where it's going to elevate your game? Or do you want the doctor that's studying but can limit himself only by the books he or she reads for that time? And as we know, medicine is doubling knowledge every 72 days. Back in the 1950s, medical knowledge would double around every 50 years. And so it's really hard for the average person to just be able to keep up. So who would you want? And from an ethical point of view, can you argue in saying, dude, you're creating malpractice. You're actually hurting patients and you don't even know.
I think it sounds like I guess the challenge is always like, as you mentioned, like the knowledge is moving so fast, and not just the end users, but like, let's say even, I believe you guys spend a lot of time outside your job to keep up with the tech also. And so maybe it also changes the landscape for new job scopes where there are going to be different.
I think it will become as important as ever as the medical practitioner have peer-reviewed as content published and made accessible to AI. Since AI is leveraging knowledge humans create, review, and validation, it's important to make sure we are not poisoning the knowledge well. So yeah, totally agree. Because that's one of the issues we're having right now. If AI is getting into our medical literature, and let's just say some of it may be garbage and it's not being reinforced by the doctor saying, this is correct or not, then we're putting garbage on top of garbage. And so that line of data could be totally off. That's why we need us.
And is that where like our medical societies come in, like the American Academy of Pediatrics, where we have standardized protocols for treatment plans and things like that? It's like there is accountability within the organization that, hey, what the recommendations that we're putting out have been reviewed. And I think that's something where that has to be extended to AI and what's available. It's on us to kind of, as on an organizational level, at least be aware of what's there and make sure that it's accessible even to the practitioners.
So I had a situation. I'm an athlete, number 2 in the country for my particular sport, and I remember going through a battery of tests because I actually had an LAD in a race, and I finished the race and I still made Team USA. But the point, and there's a lot of tech involved, but what I'm trying to get to is they did a ton of tests. And I went through an all day battery of tests. And at the end, and I'll never forget this, it's Dr. Dermot McPhelan. He's a star, cardiologist that takes care of many high profile athletes. And he asked me one question at the end of all that. He had this whole treasure trove of data. He asked me one question. He said, "Why do you race for Team USA?" And I broke down crying, and he said, "Go race." To this day, I have no idea what the statistics, what all the data showed. He didn't need to tell me, So there's that balance. It's great to have the data, and I'm a huge believer in it. But I love the fact how empathetic he was and how he just got to the heart. Like, what's important to me, what's important to the patient. It's not always the data. It's like, what drives you? What brings joy? Joy is not necessarily having a ton of data. It could be for some people. And so it's up to that clinician at the end to understand their patient and what's best for them. How do they want to receive news? And so who knows? I could be at 99% risk factor to have another LAD during a race, but I'm having the time of my life.
Exactly. And that's where I say, let the doctors be the empathetic. Let us give that compassion. And I know I'm going to sound a little crazy here, but I really think we have energy. I think we love on our patients, and we're in part giving that to our patients, and we're helping elevate them because we care so much. And I know that sounds odd for some people out there, but I really believe in that power of touch. I tell nurses, do not call me by my first name when we're in front of a patient. Not because I need to be called doctor, because I feel like you're going to take away that emotional state where the doctor and the patient says, oh my God, Dr. Castro put his hand on my shoulder and said, everything's going to work out. Everything's going to be fine. We got this. Versus, hey, Joe, come on in. Like they just degrades me. And again, it's not about the name, but it's that power that Ed's talking about. And I really think that's what we need to put channel into, in the sense that it's human plus AI, like you just said.
I'll just make a comment about balance. We're talking about all these amazing potential, technologies that may become implemented, in our near future. But to take it back, there's something also very healing about going outside and, being in the sunshine and, putting your bare feet in the grass and putting good food in your body. And I guess I just want to kind of bring that back to our attention too. It's like all of these things are amazing, and I'm so grateful to be having all these conversations, but it also doesn't replace all the things that we have known and experienced for centuries. So just a reminder to keep that balance in mind.
What can you do with that knowledge that you learned today to help humanity? What can I do as me, that human plus AI? What did I learn so I can elevate whatever that is? And for us healthcare physicians, it's going to be our patient. What can we do to help that person? And with that positive note, I want to thank everyone on the panel. Thank you for coming, and I really appreciate it.